Dry needling has been used by physical therapists in the United States for about the last 30 to 40 years. In our practice setting, we've been using it for about 3 years. In that time, it's become a very important component of our physical therapy treatments. I think it's also important that I differentiate dry needling from acupuncture because there's a big difference between the two. Dry needling is a Western philosophy. Acupuncture is an Eastern philosophy based on more Chinese traditional treatments. Dry needling, we're going to look at restrictions in range of motion, limits in mobility, and where pain is coming from. For acupuncture, they would evaluate your tongue. They can describe different types of radial pulses. They would look at meridians and energy zones. Dry needling is always combined with exercise, and acupuncture is always going to be combined with herbs, nutritional supplements, and other areas of their expertise.
Hi, my name is Steve Studer, and I've had several knee surgeries and was experiencing quite a bit of pain in my hamstrings and calves. And so I visited with my therapist, and he suggested that I do some dry needling in those areas. And we went ahead and we did 3 sessions, I think, in each area, and the results were dramatic. Within a day, the pain had lessened and was pretty much gone and allowed me to function the way I wanted to function. So I'm a big proponent of dry needling and these sorts of things. A lot of people who might need dry needling might be a little bit apprehensive about pain. I can assure you that I've had several of these treatments and has experienced minimal to no discomfort. Even when electrical stimulus is applied, there is no pain. You can feel the twitching, but you really don't get any pain. So if someone needs it, pain would be the last of my concerns, and getting better would be the most of my concern.
We're going to search out the muscle, and we're going to find what we'd look for trigger points or active sites within the muscle that could limit Steve's mobility. Once we find those areas, we're going to take a small filament we're going to insert that filament into that area. Frequently, we will get a muscle twitch response. When I'm working on Steve's hamstring, we'll usually do multiple areas. So I'll find his neck spot. Insert that second filament. Not always, but frequently we will use electrical stimulation as a part of this. And with this, we're trying to generate a muscle twitch response or a muscle contraction. That is the desired response we're looking for. Usually we'll treat each site for 20 to 30 seconds, and most likely I would end up treating various muscles for Steve. Once we're done, the filaments are removed. And at that point, I would get Steve up, reassess his range of motion mobility, because frequently we'll see a change right within the session itself. Dry needling is never just a standalone treatment. If you come here for a PT session, you would be seen for the dry needling component, but it's always going to incorporate exercise and exercises to do at home. The common diagnosis that we would use for this, almost everything that is sent to a normal physical therapy setting that involves pain and has a restriction in mobility or range of motion. The examples would be neck and low back pain, shoulder pain. It could be a frozen shoulder. It could be after a surgery when the patient is having difficulty recovering their normal mobility. It can be just for plantar fasciitis, shin splints, hamstring strains, common sports injuries. But also we've found that the chronic pain patient has tolerated this treatment extremely well, and it's been very beneficial for that component.